Hi, good evening. My name is EMT Stoddard, and today we will be discussing 5 medications that EMTs are able to provide in the field. So, the 5 medications that we will be discussing today are aspirin, nitroglycerin, oxygen, oral glucose, and an Epi-pen. Right? So let's start off with nitroglycerin. It's used primarily to provide relief from angina pain or chest pain, as some persons might call it. So basically, the indications for administering nitroglycerin is chest pain. Some of the contraindications of administering nitroglycerin would be if the patient is allergic to nitroglycerin or if they have severe anemia, basically. So the route for the nitroglycerin would be under the tongue, right? Or it could also be through the skin via a skin patch or a powder form or a spray form, right? The dosage for nitroglycerin is 2.5 to about 6.5 milligrams 3 to 4 times a day. And some of the side effects that we would look out for with the nitroglycerin would be severe skin rash. So if the patient is developing a severe skin reaction to the nitroglycerin, that would be a side effect. Usually redness around the arm, the neck, the face, swollen skin anywhere. That could be also a side effect of nitroglycerin. So the next medication that we have is aspirin, right? And as you know, aspirin can be prescribed for patients who have a fever, well, not necessarily, a headache, right? It's basically a painkiller, right? Basically, it's used to provide relief for headaches, toothaches, migraines. It can be used to treat colds and flu as well, like type symptoms, and also brings down a high fever, right? Now, some of the indications for it would be a fever, heart attack, chest pains. So, chest pains that are heart attack in nature, yeah, aspirin can be used for that. Some of the contraindications would be if they're allergic to ibuprofen. And it's a main component in aspirin. So if you're allergic to that, you cannot get it. Someone who has asthma, aspirin has been known to exacerbate someone's asthmatic conditions, worsen it. There's also an increased risk of gastrointestinal bleeding in patients with gastritis or any gastronomical disorders. The route for the aspirin is usually orally, but that's in the mouth, like they would get a glass of water and take it orally, swallow it down into their esophagus, into their stomach. Or it could be IV related. So if you're in the field with an advanced EMT, you could also be administering it via IV route as well. The dosage is usually 300 to 650 milligrams every 4 to 6 hours or as needed, right? Some of the side effects for aspirin can be like stomach pain. The patient can have stomach pain, cramping in their stomach, burning in their stomach, black stools that are type of looking like a tar, like texture, blood or cloudy urine, chest pain or discomfort, constipation, confusion. Some of those things are also side effects of aspirin. So the next medication we'll be looking at is oxygen, right? So a patient can be given oxygen when they are hypoxic, right? Hypoxemia, whether their oxygen levels are low oxygen levels, right? Or they're not breathing properly, like they're breathing abnormally, they would be given oxygen. Respiratory failure, respiratory distress, respiratory arrest, asthma, pneumonia, COPD, all of those are reasons for giving them, and there are indications as well for giving someone oxygen. Some of the contraindications would be if the patient has a tension pneumothorax, right? and it is left untreated. So if you're there and you're unable to treat it, and you notice the patient with attention pneumothorax, it is contraindicated to give them oxygen. The route for oxygen is via nasal cannula in the nostrils, or a face mask, a non-rebreather mask over the mouth and the nose. Right? Some of the side effects for giving someone oxygen, they would get a dry nose, or it would dry the mucous membrane in the nose, or they will start to have, if they have a bloody nose, right? Say if their nose is already dried out, that would be a side effect. And if they have a bloody nose, then that would be a side effect as well. Tiredness, if the patient complains of being tired, that you want to sleep, that's also a side effect. Headaches, skin irritations in COPD patients, yes, skin irritations in COPD patients, right? That also is a side effect of oxygen. So oral glucose now, that's the next medication now. So oral glucose is given to patients who have a severely low blood sugar reading, right? So if their blood glucose levels are extremely low, you would give it to them. The indication of this level would be if the patient blood glucose reading is below 4 millimoles per liter, right? So if that is the reading that you would get, then you would administer oral glucose. The route is usually orally inside the cheek, the mucous membrane along the cheek walls. You would make a paste, put it inside the mouth, and rub it up along the cheek walls so it can be absorbed into the mucous membrane. The dosage is usually 15 to 45 grams of oral paste for adults. Some of the side effects of oral glucose would be the patient would be exhibiting confusion, they would be expressing a lightheaded feeling, like they want to pass out or something, swelling as well to their arms or their feet. That's also an indication of a side effect. Also sweating and pale skin, maybe, probably shortness of breath, and some chest pain is possible as side effects with oral glucose. So the last medication that we are going to be discussing is the Epi-pen, right? And this is a medication that is used in emergency cases where there is an anaphylactic emergency, an allergic reaction to something, right? To any form of food or grass or pollen, something in the air, right? Insect bite and animal bite sometimes. You understand? Wasps, bees, insects, and so forth. Those reactions, allergic reactions, are indications that this person needs the use of an Epi-pen. Some of the contraindications, well, according to what is widely known out there in the field, there is no absolute contraindication. However, certain cases you have to be mindful. Like, for instance, if the person is a known heart attack patient, right, or they have an overreactive thyroid gland, or they are diabetic, you understand me? Caution needs to be utilized for those patients, right? So even though there are no contraindications, you should be cautious of those types of patients. So the route for Epi-pen is usually intramuscular, injected in the outer thigh of the patient, and the dosage is usually 0.3 milligrams. So side effects would include skin redness, warmth or tenderness in the area that was injected, sometimes nausea, vomiting, sweating, and sometimes they would express some form of dizziness as well, right? So those would be the side effects. A point to note, for children who are 33 to probably 60 odd pounds in weight, right? Sometimes a second dose may be needed after every 15 minutes, after every 5 to 15 minutes. If the symptoms persist, that is, if the symptoms persist. So that is my rundown. Thank you very much. Have a wonderful day.